Dear colleagues and friends, my name is Paolo Casentini and I would like to share with you this case where the posterior atrophic maxilla was treated following the concept of prosthetically guided regeneration. We published this concept some years ago on Period 2000 together with my mentor Matteo Chiapasco. And that was the resume of the technique that we are using since the last 15 years. So PGR is not a specific technique, but it's more a philosophy of work that puts at the center of the workflow the prosthetic project. So everything starts from the prosthetic project, and the prosthetic project is guiding the next steps, meaning that the implants are prosthetically driven, implant placement is prosthetically driven, but also bone augmentation techniques and soft tissue augmentation techniques are performed following the same concept. And then we finalize the case after soft tissue conditioning. Okay, so this creates a circle where we always have the control of what we are doing during the treatment. So let me introduce you our patient, Francesca, that is 59 years old. She's in good general health. She's non-smoker, and she has a request to improve her aesthetics and function with a fixed reconstruction. Because as you can see, she has lost many teeth in the upper jaw. She also has the left upper canine that is a hopeless tooth with degree-free mobility, and in the lower arch she has no significant problems, and she has almost her entire dentition. You can also see how these the residual teeth, the residual frontal teeth of the patient has advanced wear and are really not in good condition. So we create a preliminary treatment plan and sequence that starts, of course, from preliminary impressions and mounting her case on an articulator. And it is very important since we, as we said, we always like to start with the prosthetic project in our mind. So we ask the dental technician to wax the missing posterior teeth, but also to create again a normal shape of the frontal teeth and restore their correct anatomy. And then we will immediately start creating a temporary partial removable prosthesis based on the new anatomy of the frontal teeth, and on the same anatomy we'll also create a diagnostic template that will allow us to achieve more information about the bone anatomy and the bone volume in the posterior areas of the maxilla. So that's how with digital smile design technique we are replanning the shape of the frontal teeth, and that's how the dental technician is waxing them, creating an improved vertical dimension and correcting the collapse of her occlusion. Then we will print using a silicone guide the mock-up, and we will do this in the same appointment where the canine will be extracted. Okay, so now we have a new shape of the frontal teeth, and based on that we will deliver the partially removable denture that will allow this patient to have since the very beginning a better improved aesthetics and function, and will allow us also to test somehow the new occlusal system and the new occlusion that we want to test in this patient. So you see how since the beginning we are trying to improve following a new project the aesthetics and the function of the patient. So now it's time, after a couple of months after extraction, to go back to this case and to test with a diagnostic template that is based again on the same prosthetic project and to test, I was saying which kind of anatomy, which kind of bone volume we have in the posterior areas of the maxilla. So that's the combine that the patient is performing. And unfortunately, as you can see from the different sites analysis that we are doing, it's not possible to place implants in any of the evaluated sites. So now we have all the elements to make the final treatment plan for this case, that will include a preliminary bone reconstruction with bilateral sinus floor elevation combined with GBR in order to create enough width of the bone crest. And then after 6 months, it will be possible to place implants, again always following the initial prosthetic plan. And we will also perform at this stage of treatment, soft tissue augmentation by means of collagen matrix. And then we will move to the temporary prosthetic reconstruction phase, and finally it will be possible to finalize the case. And the final reconstruction will include some implant supported screw retained bridges in the posterior and ceramic veneers at the frontal teeth. So as you can see here, we will use the diagnostic template not only for diagnosis but also to guide the following steps of treatment. And it is a very important concept following PGR concept, because as you will see, this will allow us to make the bone reconstruction exactly following what we really need in terms of bone volume, in order to be able in a second stage to create a proper emergence profile of the implant supported reconstruction. It is our flap design, and we will start the procedure from the posterior mandible, where we will collect with a scraper some autogenous bone chips. So you see how the incision is performed in this area, and in this area it's possible to create and to find very shortly the bone layer, and that's how with the scraper we can collect the bone. The autogenous bone will be useful and mandatory not for the sinus floor, and we will not put autogenous bone in the sinus floor because we don't really need it. We can do this also all with bios, with a xenograft, but the presence of autogenous bone will be mandatory in order to create the width with guided bone regeneration. After elevating the flap, we will immediately release it, because at this stage, preliminary stage of the surgery, we usually have a very good vasoconstriction effect of the anesthetics. Okay, and you see how it is possible to release the flap and achieve, that will be important to achieve a tension-free suture. Okay, the guide will also help us to localize the sinus floor and the best position to create our window, that will be created with a diamond burr on a right handpiece. Okay, so we do our window, lateral window in the sinus with again guided by our project and by our prosthetic guide. Okay, so you see here how the membrane and the window starts to move, and we will follow always and keep the contact with the bone with our sinus floor elevators. Okay, that is very important in order to limit the risk of membrane Schneiderian membrane perforation. We will also perform some small perforations in the lateral wall in order to increase revascularization of our graft. And now it's time to measure the site and to place our membrane. And we usually prefer to start with this, stabilizing and fixating the membrane with some titanium pins is very important, because this will allow us to achieve a perfect stability of the graft. So depending on the size of the site, it is important to use some pins, okay, and the number of pins, of course, is also related to the extension of the area. Once the pins are able to stabilize the membrane, we open it, and we can use the BioSpan in order to inject and to place our biomaterial inside the sinus floor. And I really like this instrument because this is really helping us to improve the ergonomics of the surgery. So you see that I'm using my one hand in order to retract the flap and the membrane, and I have with only one hand it is possible to inject the biomaterial. You can see I'm using large granules of BIOS that are my favorite grafting material for the sinus because they leave more space for bone regeneration. In the external part of the graft, that is that part that corresponds to GBR, we will use a 50% mixture between BIOS, small granules, and autogenous bone. And that's how we create the mixture, okay, with the autogenous bone that has been collected from the posterior mandible. And so you see the biomaterial is mixed, and then we will use this composite graft to graft the horizontal defect. Okay, so it will be packed a little bit with retractors. Okay, and then after creating a nice shape of the and correcting the defect, we will finalize and put the final pins in order to stabilize perfectly our membrane and our graft. And as I said before, a perfect, stable, and not mobile graft is important because this will allow us to achieve a very nice regeneration. And this is the picture that probably highlights better the concept of the PGR, because you see that we are creating our bone reconstruction exactly following our prosthetic project, and the prosthetic guide will help us to make the bone reconstruction exactly following what we would like to achieve in a later stage. So the procedure is performed both sides, and that was made in deep sedation. Okay. And you can see here the suture and the panoramic radiograph that allow us to check the graft. So after 6 months, it's time to come back. So we use for the third time the diagnostic template in order to make a new combine. And so this time you can see we have all the bone volume that we need to place our implants. You can see here a comparison in the same sites where implants will be placed before and after the reconstruction. You see how now we really have what we needed in order to place our implants. So again, implants are placed using the last time the prosthetic guide, okay? And in the same time we want to improve a little bit more the shape of the crest, and to do this we are using now soft tissue augmentation techniques. And since this patient already had invasive surgery, we want to limit as possible the invasivity of this surgery, and that's why we are using FibroGuide collagen membrane in order to avoid the harvesting procedure of connective tissue graft from the palate. And you can see how we are not only placing the Fabro guide metrics externally, but we are also making partial thickness incision in the palate in order to move a little bit the palatal mucosa in the buccal direction. Same surgery is used on the left side, where 3 implants will be placed, because here we will need to replace 4 missing teeth. And then after, and you can see here the final aspect of the bilateral treated side. So we are using rapidly osseointegrating implants. We're using Straumann implants here with a selective surface. So this means that after very few weeks, we will be able to start the restorative procedure. We will take our impressions and bite registration, and finally, we will be able to provide a temporary screw-retained reconstruction to this patient. Okay, so you see that the patient starts to look like we planned since the beginning. She likes to you start to see again the posterior areas of the maxilla that has been augmented both in the hard and the soft tissue sides. And the temporary reconstruction is very important because the patient is not using her posterior teeth since a significant amount of time. So it will be able and it will allow the patient to come back to a normal occlusion, and of course this requires some time. Okay, so after some months it will be possible to go for the final impressions. Okay, both on natural teeth for veneers and on the soft tissues that has also been conditioned by the temporary reconstruction, and it's time to go for the final reconstruction. So you see here in the model the zirconia ceramic based bridges that are again screw retained like the temporary ones, and the ceramic veneers on the frontal residual teeth. And here we also need a very good dental technician like Alessandro Giacometti in order to be able to manage perfectly the veneering of ceramic and the finalization of the case. And here you can see finally the final result. You see, I would like to highlight how the emergence profile of the implant supported reconstruction seems natural, and that is because of the soft and hard tissue augmentation techniques that are very important in order to achieve something that is really similar to the natural dentition. Here you see the final reconstruction in an occlusal view and the huge transformation that this patient had before and after the treatment. Okay, so this means that the patient was really able to get back her aesthetics, her function, and I can tell you now that Francesca is really a happy patient that was able through treatment to get not only better aesthetics and function, but also to increase her self-estimate, and was changing a little bit the way to act and to interact with other people. And you see here her beautiful smile. So to resume and to finalize the presentation, I want to underline the importance of following a prosthetically guided regeneration concept. That, as I said, is really an innovative concept that is allowing us to move very safely through the different steps of treatment, especially of complex cases, always having a control of what we are doing, because everything is really guided by the preliminary prosthetic concept and project. And so we can reduce the amount of mistakes that we are doing, and we always have the control of what we are doing. Okay, thank you very much.